Thank you very much for being here. Here is Kentucky Senator Rand Paul, also a medical professional, slamming Dr. Fauci's cheap politics. Watch.
Do you really think it's appropriate to use your $420,000 salary to attack scientists that disagree with you?
Senator, the email you're referring to was an email of Dr. Collins to me. If you look at the email
that you responded to and hurried up and said, I can do it, we got something in Wired magazine.
No, I think in usual fashion, Senator, you are distorting everything about me.
Congressman, what do you make of Dr. Fauci's excuses? Why does anyone still trust this guy?
Well, it's beyond me, especially as a physician. But I don't know that Dr. Fauci has actually been out there treating COVID patients either. So why is he the foremost authority on all of this? And I think that people should be talking to their doctors about what's going on and not necessarily waiting for what Dr. Fauci has to say. But I will say this, you can also look at Dr. Fauci's emails when he was asked about the origins of COVID, for example. And, you know, without any evidence whatsoever, he comes forward and comes out and says, hey, this came from an animal, and acting like we know that, and don't anyone challenge me. That's not how science works. You know, we're supposed to have discussions. We're supposed to go back and forth. We're supposed to look at all angles. And, you know, until, for example, the origins of COVID, until we know definitely one way or the other, we need to be exploring both ways and not criticizing people that say something different from you, especially if they're bringing forward scientific evidence. You know, John Adams said facts are stubborn things, but they don't seem to be stubborn things with a lot of people. And you always have to look at the facts. So the facts are coming out. You did a great job, Chris. You did a great job in your opening because you covered everything that I really would want to say. And facts matter. Look, we knew from the beginning, the very beginning with the trials, that the vaccines still get through. So there were some people that were vaccinated in the trials that got coronavirus. We also know that viruses produce variants. So this is going to be an evolving thing. And you know what? Maybe you had some wrong idea at the beginning. You have to admit that and come out and say, we were wrong on this. Now it's showing this. Now it's doing this. And the variants are going to do different things. And decisions on what takes place in our communities, in our hospitals, should be made at a local level, not in Washington, D.C. We got health directors in every county in the country. We put lockdowns on counties. We put lockdowns on hospitals that had no cases. That's what we were doing at the beginning. Let's be smarter as we go forward and treat people. And you know what? When you talk about the facts, I want to know how many people developed COVID while in the hospital, that came in without COVID and then developed why they were in there for their heart attack or for their fractured hip.
Yeah, Congressman, you know.
Like that.
Yeah. No, I think that's all information, but as you know, before I get on to this next question, I wanted to touch base on something that you and I we've been skirting around the edge here. There are doctors and medical professionals in this country who are afraid. They are afraid to practice medicine the way that they have for centuries in this country, because their government is coming down on them to comply with a political agenda rather than a medical and scientific agenda. And it's dangerous. And those who are pushing this ought to be ashamed of themselves in the medical establishment inside of Washington. It's making us less safe, it's making us less healthy, and it's stifling scientific debate and discovery. And shame on the totalitarians in this government for doing that. And that leads me right to my next question, Congressman. New military documents are reportedly confirming that Dr. Fauci knew the NIH was funding gain-of-function research in communist China and Wuhan. Now, if this is true, Fauci lied under oath in his testimony to Congress. Americans are wondering why the party in power, the Socialist Democrats, would permit lying to Congress, and still others are wondering why the entire GOP isn't unified in holding the highest paid government employee to the same standards any of us would be held to if we went up there and lied to Congress. Your answer, sir.
Well, we are unified in that. I think we're unified virtually 100%. I don't know a Republican member of the House of Representatives that isn't unified on that message. Look, you know from open source research.
Hold on. Congressman, I'm sorry. Sorry, sir, I don't mean to interrupt, but again, just so we're clear, with the American people, we don't see Mitch McConnell and Ted Cruz locked arm in arm, sitting up there the way the Democrat socialists do, and Liz Cheney up there parading herself around with every damn camera she can find. We don't see any of the Republicans in a unified message saying this stuff has to stop. That's what I'm making allusion to. There is no unification or a guiding principle in the Republican Party. The socialists and the big government totalitarians, they're very united, and they're out there in front of every damn camera in this country. That's what I'm making allusion to when I ask you that question, Congressman.
Well, as you know, you're one of the few networks that allows us in front of their cameras to talk about these types of things. So that's one of the problems.
True.
And that's a fact, right? CNN never calls me. They don't call me to come in and talk about these types of things. So we're trying to get the message out wherever we can, and you know that we are, and we're writing op-eds, and we are standing there. Now, there could be more glorified press conferences. We as Doctors Caucuses have had them, and we will continue to have them and try to get the word out as much as we possibly can. But look, you can go to open source documents, and it shows that we, the United States of America, was funding this gain of function. Now, maybe Dr. Fauci doesn't like to use that term. Maybe he likes to refer to it as a chimera. But this is all out there. Look, you have Dr. Fauci in 2012 in an interview talking about this type of research taking place. And he said, well, I'm not worried about a pandemic. When he was asked about it in 2012, he said, because the chances of it getting out of a lab are really low and the benefits outweigh the risk. What he thought he would do is create a super virus and then a vaccine to it, and he could cure everything. Well, there was a lot of risk there, and now we're feeling that. But it's very clear, the flow of money, EcoHealth Alliance, you know, supposedly Obama put a pause on this type of research with China, but he left it up to the NIH directors to be able to decide if grant money should still go there. Listen,
Yeah,
I'm on
you know
Intelligence Committee. I'm continuing to dig, Chris. You can continue to talk to me.
Yes.
We're getting more information. We're honing in on it. And he knows all about where that money was going and what that research is all about.
Yeah, Congressman Wenstrup, if it is as you're saying, that Mr. Fauci wanted to be a hero in his own mind and create a superbug and create a vaccine for it, he made one critical error. He trusted flipping communists to do it.
Right.
And he funded our enemies of this country to do it, and he needs to be held accountable. Congressman Brad Wenstrup, thank you, sir. We appreciate your time and your efforts. You're welcome back anytime. Still to come,